Myself, Dr. Vijay Sheker Reddy, consultant endocrinologist at Yashoda Malakpet. On this World Diabetic Day. This day is celebrated to commemorate the birth anniversary of Frederick Banting, who has invented insulin. This day is celebrated to educate the people and make an awareness about the diabetes. And theme of the World Diabetic Day this year is access to the diabetes care. So regarding this, I like to have few words regarding the diabetes and the diet. The diabetes is a chronic metabolic disorder characterized by chronic hyperglycemia leading to dysfunction failure of various organs, secondary to insulin deficiency or action due to various causes. And we know that we have got 4 groups of diabetes: type 1, type 2 diabetes, secondary diabetes and gestational diabetes, and of which type 2 diabetes is very common disease. We know that the real genesis may be due to many genetic factors, but it is the environmental factors or the lifestyle which triggers the event, that is the diabetes. And the main component of the treatment for this diabetes is the lifestyle control, the main component of which is the diet. So I'll just speak to you on the few words on the diet. We know that the healthy diet is what is called a normal diet. There's nothing specific what is diabetic diet. What is important in prescribing a diabetic diet is first prescribing the calories he or she requires. It is based on the ideal body weight, and we again based on his activity weight, we prescribe him his calories, and these calories are divided. The source of calories should be from the carbohydrates, which should be around 50 to 60%, fats, which should be about 25 to 30%, proteins, which should be around 15 to 20%. And it is the carbohydrate which influences or which has got immediate impact on the glycemic control. So what we do is we try to choose the food which contains a complex carbohydrates and which contains a low glycemic index foods. And regarding the fat, the distribution should be balanced between saturated fatty acids, monounsaturated fatty acids, polyunsaturated fatty acids. In reality, I want to emphasize one thing here. We got what are called both visible fats and invisible fats. So visible fats should be restricted up to 20 to 50 grams per day per individual based on his activities. And regarding the protein intake, I told you it is about 20%. The requirement will be around 1 gram per kg per day, and it should be restricted in case of nephropathy, and vegetarian protein should be encouraged. Apart from these carbohydrates, fats and protein, you need to prescribe the fiber, which should be at least 15 to 20 grams per 1000 kilocalories prescribed. Thirdly, you should see that the good number of micronutrients like calcium and iron are to be included in the diet, vitamins to be included. Apart from this, there are what are called functional foods. That is, apart from their the other help, like fenugreek seeds, which will help you to control both the glycemia and lipids if it's consumed roughly around 15 to 50 grams per day. Apart from this, even your oats, which contain alpha glucans, which will also help for reduction of the cholesterol in the diet. And the other things which I also like to tell you, there are what are called free diets in the diet. That means these diets can be encouraged to take, can be taken more, like vegetables or some soups or thin buttermilk or lime water can be taken a little more. And lastly, what I like to say is, alcohol should be discouraged because it only adds to the dry calories, and especially in a diabetic, it may predispose to hypoglycemia and neuropathy. Lastly, I want to tell about the use of the sweeteners, which is again to be discouraged. Thank you.